Hello there, and welcome to This Explainer. I want you to picture something for a second. You're sitting in the doctor's office. You know the exact feeling, right? That crinkly paper is rustling underneath you on the exam table. The nurse comes in, smiles, and wraps that familiar tight cuff around your arm. It pumps up, gives your arm a good squeeze, slowly hisses out the air, and then you hear the verdict. They look at the chart and say, well, your pressure is just a little high today. We really want to get you below 120/80. Now, if you're over the age of 60, there is a very good chance you have lived this exact scenario. And like most of us, you trusted the professional. You went home, maybe you picked up a new prescription at the pharmacy, and you started taking a new medication. Because naturally, we all assume that a lower number is always a better number. But what if I told you that for a whole lot of adults over the age of 65, that standard accepted advice might actually be completely wrong? Today, we are exploring a paradigm shift in medicine. We're going to look at why chasing that perfect 120/80 on the blood pressure cuff might actually be hurting you rather than helping you.
So let me ask you a question, and I want you to really think about how you've been feeling lately. Have you recently felt a sudden wave of dizziness when you stand up from your favorite chair in the living room? Or maybe do you experience this strange, heavy brain fog that just rolls in right in the middle of the afternoon? Or perhaps you just feel an exhaustion that doesn't really seem to go away even when you've been resting. A lot of seniors, and maybe you've done this yourself, just brush these feelings off. You think, well, I guess I'm just getting older. This is just what happens. But the truth, and this is coming directly from recent clinical research, is that these symptoms might not be a natural part of aging at all. Instead, they could be precise, urgent signals from your own body telling you that your blood pressure medication target is simply way too aggressive. Your body might literally be struggling in silence, just trying to keep up with the numbers written on that prescription pad.
Okay, let's dive into this. We have a great roadmap for today's explainer, and we are going to take this nice and slow. First up, we'll unpack the 120/80 myth itself. Then we'll look at the natural ways aging changes your arteries. Third, we're going to look closely at the hidden fine print of the clinical trials that set these rules. After that, we'll explain something called the J-curve phenomenon. Fifth, we'll figure out how to find your actual, real target. And finally, I'm going to give you the exact tools you need for talking to your doctor. So let's start right at the beginning with section 1. Where did this golden number of 120/80 actually come from in the first place? You see, for decades, doctors studied these massive groups of mostly younger adults, and what they observed was a simple correlation. People whose blood pressure naturally sat around 120/80 without any medication tended to have fewer heart attacks over their lifetimes. So, perfectly logically, it became the standard target. But as you know, medical science is a constant evolution. Let's look at this timeline. If you go back to the 1970s and 80s, medicine was deeply focused on the diastolic, that's the bottom number on your reading. Then by the time the 1990s rolled around, the focus entirely shifted to the systolic, the top number. Then came a massive shift in 2015 with something called the SPRINT trial, which aggressively pushed doctors to aim for 120/80 for pretty much everyone. But here we are today, and modern cardiology is fundamentally rethinking these targets for seniors. Why? Because those foundational studies were mostly conducted on younger people. People with pristine organs, flexible arteries, and no daily medications. That is incredibly different from a typical 75-year-old who is managing a real complex life. That brings us perfectly to our second point, how aging actually changes our arteries, and the very natural biological shift that happens inside your body as the years go by. I really want to validate something right now. It is completely 100% normal that a 70-year-old body operates differently than a 40-year-old one. The way blood moves through your chest and your limbs at 65 is just biologically different. Think of your arteries like a garden hose. When you're in your 20s and 30s, your blood vessels are like a brand new green rubber hose you just bought at the hardware store. They're stretchy, they're flexible, and they easily handle low water pressure. But as we age, our large arteries naturally begin to stiffen. Picture an old garden hose that's been left out in the hot summer sun for a few years. It loses that stretch. It becomes stiff and a bit brittle. Because of this totally natural stiffening process, your heart actually has to push a little bit harder to move blood all the way through your body. The higher pressure you see on the cuff isn't necessarily a failure of your body. Often, it's an adaptation. Your heart needs that extra pressure just to push the blood through those stiffer, older vessels. Now, what's really fascinating about this slide is how your brain handles this change. Your brain is a remarkably demanding organ. It absolutely requires a steady, constant flow of oxygen-rich blood no matter what. When you are younger, your flexible vessels adjust instantly when you stand up or sit down. But after 60, we see a shift in something called cerebral autoregulation. That's just a fancy medical term for your brain's ability to control its own blood supply.
Because your arteries have stiffened, your brain actively recalibrates itself. It learns to rely on a slightly higher blood pressure just to get the exact same amount of blood it used to get at a lower pressure. So think about what happens if a well-meaning doctor aggressively forces your blood pressure down to 120 with heavy medications. Your brain essentially gets starved. It just isn't getting enough blood flow at that artificially low pressure. And that's exactly when you begin to feel that fuzzy, slow, dizzy sensation.
So let's look at the signs. Your body is incredibly precise in how it signals that a medication target is too low. It doesn't use words, but it uses feelings. Dizziness when standing up simply means your brain isn't getting blood fast enough when you change positions. That afternoon brain fog, that points to your overall blood pressure being held artificially low all day. Unexplained exhaustion happens when your major organs are working overtime without enough pressure driving the necessary blood to them. You might feel a bit unsteady on your feet, almost like you've lost your balance. Also, if you use a monitor at home, frequent systolic dips, that's the top number, dropping below 100 is a massive red flag. Finally, unexplained muscle cramps can occur, especially if certain medications like diuretics or water pills are flushing out vital minerals like potassium and magnesium while trying to lower your pressure. These aren't just signs of getting older, they are clear signals from your body.
Which brings us to Section 3, the hidden trial fine print. Let's pull back the curtain and look at who was really in the studies that set these strict guidelines we all live by today.
Earlier, I mentioned the famous SPRINT trial from 2015. This was a landmark study, and it pushed doctors everywhere to aggressively aim for 120 over 80. The big, flashy headline results showed fewer heart attacks, and it changed the global medical guidelines practically overnight. But if you actually read the fine print of the study, the reality of the data changes completely. To get those perfect, clean results, the researchers excluded massive, massive portions of the senior population. Look at this list. They excluded people with diabetes. They excluded anyone who had suffered a previous stroke. They excluded people with dementia, those with advanced kidney disease, and anyone dealing with serious frailty. So what does that mean? It means the medical guideline to push your blood pressure down to 120 over 80 was built almost entirely on the absolute healthiest, most resilient older adults. It was absolutely not built for the typical senior who is managing a real complex medical life with multiple conditions.
And sadly, the data gets even more concerning when you look closely at the adverse events from that very same trial. Even within that carefully selected, super healthy group of older adults, pushing their blood pressure down to 120 actually caused significant documented harm. The group receiving the intensive treatment to get their numbers that low experienced a shocking 50% increase in acute kidney injuries. Their kidneys just couldn't handle the lack of pressure. They also suffered from dangerous electrolyte abnormalities. They experienced much higher rates of falls that actually required medical attention in a hospital. And they had a higher rate of syncope, which is the medical term for sudden fainting or loss of consciousness. So for real-world patients, the side effects of chasing 120 over 80 are significant, they are real, and they are thoroughly documented in peer-reviewed literature, even if they sometimes get ignored in the rush to hit a perfect number on a chart.
Now we come to Section 4, and this is absolutely crucial. We're going to talk about the J-curve phenomenon. This is the point where lower blood pressure actually becomes more dangerous. To truly understand why lower is not always better, we have to look at the mechanical needs of your heart. In medicine, there's a concept known as the J-curve phenomenon. I want you to mentally picture the letter J. Start at the top left. As your blood pressure goes down, your risk of having a heart event drops right along with it. That is the long descending stem of the letter J. But eventually, you hit the bottom hook. If your blood pressure drops below a certain threshold, the risk actually begins to rise sharply again. It forms that hook. There is a floor below which reducing your blood pressure causes real harm. You see, between heartbeats, when your heart is briefly resting, that is exactly when your coronary arteries fill up with fresh blood. If your overall pressure drops too low during that split-second rest period, your own heart muscle simply does not receive enough oxygen to survive and thrive.
Because of this, I want to empower you to do something. Next time you take your readings at home, I want you to specifically check your diastolic pressure. That is the bottom number. Is it consistently dropping below 60 or 65? If it is, please know that this is not a victory. Multiple large-scale studies have shown that in older adults, a diastolic pressure sitting below 60 is heavily associated with an increased risk of cognitive decline and cardiovascular events. A bottom number sitting at 58 might represent something called silent ischemia. That means there is an insufficient oxygen delivery to your heart tissue with every single beat, and you wouldn't even feel it happening.
And this brilliantly illustrates another major risk factor: orthostatic hypertension. This is something that directly threatens your daily physical safety and your independence. It's a big term, but it just describes a dangerous, rapid drop in blood pressure that happens the moment you stand up from a sitting or lying down position.
If you've ever gotten out of bed or stood up from a chair and felt the room immediately tilt sideways before your circulation finally caught up, that right there is orthostatic hypotension. As we age, our bodies naturally take a bit longer to compensate for the sudden change in gravity when we stand. But aggressive blood pressure medications make this drop much, much larger and significantly more sustained. Now, I don't share this next number to frighten you, but I need to be firm about why this matters. In a 72-year-old who is on aggressive blood pressure medication, that momentary dizziness is a fracture just waiting to happen. A medication-driven fall can easily result in a broken hip. And in adults over the age of 70, a hip fracture carries a staggering one-year mortality rate that approaches 30%. Pushing a blood pressure target too low and inadvertently causing a fall is a deeply serious medical event that can instantly end a senior's independence. We absolutely have to balance the potential, theoretical long-term heart benefits against the immediate, real-world daily physical safety of just standing up from the kitchen table. So what do we do about all this? Let's shift gears to Section 5, finding your real target. The most important thing to remember here is that you are a completely unique person, not just a number on a spreadsheet. So the crucial point is that the optimal target completely depends on your individual factors. Things like your age, your kidney function, your daily mobility, and frankly, just how you feel day to day. Thoughtful, modern cardiologists use a specific framework to figure this out. Let's walk through these 3 profiles. If you match Profile 1, you're highly independent, between 60 and 79, no major health conditions, and you never get dizzy when you stand, then an aggressive target below 130 makes total sense for you. But look at Profile 2. If you're between 60 and 79, but you're managing multiple conditions like diabetes or kidney issues, pushing below 130 often causes more harm than good. For you, 130 to 140 is a much safer, smarter zone. And finally, Profile 3. If you are 80 or older, or if you are experiencing any frailty or history of falls, geriatric specialists overwhelmingly agree that a target of 130 to 150 is actually the safest place to be. That little bit of extra pressure keeps your organs perfectly fueled and keeps you from getting dizzy. I love this quote from Dr. Elena Pierce. She summarizes the entire issue beautifully. She says, "Managing blood pressure after 65 is not about chasing a number. It is about understanding what your individual physiology needs." She tells this incredibly touching story about a 78-year-old patient of hers named Margaret. Margaret's previous cardiologist had stubbornly pushed her target below 130. Within just 6 weeks on the new dose, Margaret fell twice in her own home. Her bottom number was sitting at a highly dangerous 58. So Dr. Pierce stepped in and gently reduced her medication, allowing her pressure to rise a bit. The dizziness vanished instantly. Margaret was back to taking her daily morning walks. Her long-term cardiovascular risk barely shifted at all on paper, but her daily safety, her freedom, and her joy in life were completely restored. And that brings us to our final section. Section 6, talking to your doctor. I want to leave you with a comforting, practical toolkit so you know exactly how to have a better, safer conversation at your next appointment. The goal here is to transform you from a passive patient into an active, empowered partner in your own healthcare. So here are 3 simple steps. Step 1, figure out your specific profile based on what we just discussed: your age, your activity level, and your current conditions. Step 2, for 7 days before your next appointment, I want you to track how you feel, not just your cuff numbers. Write down if you felt dizzy at 2 p.m. or if you had a foggy brain after breakfast. Bringing a 7-day written log of how your unique body is actually responding to the medication is infinitely more valuable to a good doctor than a single high-stress reading taken in their clinic. And step 3, when you sit down with them, actively ask them to set a personalized target just for you. Also, this is a highly practical tip. I strongly encourage you to ask your doctor or nurse for a standing blood pressure test. Usually, they measure your pressure while you're just sitting quietly on the table. Next time, ask them to keep the cuff on your arm, have you stand up, and then take the measurement a second time within 2 minutes of standing. This simple 2-minute test can immediately reveal a dangerous medication-driven drop in your pressure. It proves to your doctor right there in the room exactly what is happening to your circulation out in your daily life when you stand up to answer the phone or get the mail. And when you sit back down after that test, I want you to have this exact question written down in your notebook. Feel free to copy this right now. Ask them, given my age, my conditions, and the symptoms I have been tracking, what is my personalized blood pressure target? I want to reassure you, asking this is not challenging the doctor's authority. You aren't questioning their medical degree. You are simply providing them with a rich, detailed picture of your life so they have better information to work with. Any good, modern doctor will completely welcome this nuance and respect you immensely for bringing this level of care and attention to the conversation. Because at the end of the day, getting your blood pressure target right in this season of your life isn't about satisfying a rigid chart printed in a textbook 10 years ago. It's about you waking up in the morning and not having to grab the hallway wall for balance. It's about having a mind that is crisp and clear before you've even had your first cup of coffee. Is the number on your blood pressure cuff a verdict? Or is it just the starting point for a better conversation about your life? You deserve a sharp mind and steady feet, so you can continue to enjoy the people who matter most to you. Now you have the knowledge to make sure the rest of the conversation is truly about you and your unique needs. Thank you so much for joining me in this explainer today, and please take good care of yourself.